right, thank you for staying with us. We're still having this conversation, and we created extra time because there are many questions and concerns coming from our audience. Let's pick just about 5 of them really fast. Yes, sir, you have the microphone over there. Let's start with you.
Thank you very much, Trevor. I'm Jacob Mwendo from Technical University of Mombasa. And my question goes direct to Dr. David. Which are the specific challenges Kenya face in implementing the anticipatory action? And how does the National Disaster Operations Center tackle the challenges? Thank you.
Okay, thank you very much. Yes, sir.
Thank you, Trevor. For me, I have a problem with what we call the risk assessment. Now, my biggest concern with the risk assessment are like, how do we prioritize which potential risks or disasters to prepare for, and what criteria do we use to assess the likelihood and the impact? Then I also have another problem to do that. We talked about technology, and everybody loves technology. So I know anything that comes with technology, there are very many negative impacts and also positive impacts on them. Now, this is my question. What are the risks of relying heavily on technology for disaster prediction and management, and how can we mitigate those risks?
State your name, sir.
My name is Eugene Opaili.
Eugene.
Yeah.
Thank you very much. Let's take just 2 more.
From Technical, Mombasa.
Fantastic. Yes, sir. And
yes,
then we'll
my name is Moretti James. My friends call me Director Van Baby. So my question is, to what extent does a disaster has to go for it to be called a national disaster? Last April and March, that is the moment that Kenya experienced the most devastating floods. And the only thing that we saw from the government is the president deploying KDF military to go and evacuate people from flooding prone areas. Now, one of your responsibility as a center is to look after the people that were evacuated. So my question is, where are those people? And if they're somewhere, what helps? What is it that you're doing to help them?
Okay.
Yes.
Thank you very much. And lastly, ma'am.
Yes, thank you so much. My name is Hannah Ndongo, working with ADRA. My question is about children and youth. We are talking about we are not leaving anyone behind. So when we talk about anticipatory action, what are we saying about children and youth and institutions, especially in the education sector? Thank you.
Okay. Yes, ma'am.
Yes, thank you so much. My name is Irene Amron, and I'm from the Red Crescent Climate Center. And mine is a comment which I would like to circle back towards community engagement and what this means for anticipatory action. So we are talking about anticipatory action, and this is not a boardroom affair. And if we want to see the success of anticipatory action, it has to start and end with the communities. We are talking about community-centered early warning systems. What does this mean? That we are designing systems with the communities, by the communities, for the communities. And we need to be able to challenge ourselves that for us, for example, to be able to understand what risks should we prioritize. This cannot be done by us. It has to be done by the communities, and community engagement is not going to be it's not going to be a popcorn affair. We need to be intentional. We need to be able to learn and unlearn from the communities so that we are able to design robust anticipatory approaches and systems. Then briefly again, another comment around what capacity gaps are faced by communities, by governments, by institutions. There are quite many, but one of those that are quite prominent is around translating the early warning information into action. How do we make the science easily understandable? For example, by my grandmother, how can she be able to take that and be able to act on that information? So we need to bridge the gap between the access and understanding and use of information and being able to take action on that. Thank you.
Thank you, Irene. Finally, yes.
Thank you very much. My name is David Kamau from World Food Program. I have a question and a comment.
Yes.
My question goes to Dr. Otieno. You indicated from evidence that investing $1 in anticipatory action generates $7. That is phenomenal. So the question is, what is IGAD doing to spur accelerated buy-in and investments in AA by governments and private sector? And then my comment, just to respond to some of the issues that come from the floor here, regarding the most vulnerable members of the communities and what we need to be doing. And I want to speak to this from a social protection angle, because that is the role that it plays in protecting the most vulnerable. And I want to bring in the aspect of anticipatory insurance services. I think this is an explored area which, going forward, we need to focus more on, because in essence, we'll be transferring the risk, but at the same time, cushioning and covering the most vulnerable, climate-affected populations who most of the time will be food insecure. And the whole subject that brings us here is, how do we think about preventing the loss of livelihoods and also humans?
Okay.
So thinking about the role of anticipatory insurance services is worth considering. Thank you so much.
Thank you very much. David, answer the questions very briefly, and then we'll come to closing remarks.
I've been asked about the challenges in implementing anticipatory action. As I've pointed out earlier on, anticipatory action is a fairly new concept that we are embracing at the moment. And most of the agencies have just been doing the piloting in different counties. So we are moving to the next stage of operationalizing this anticipatory action, and therefore that is the time when we shall be able to check where we need to step up, and any gaps that are missing, then we are able to fill up. I've been asked also about where are the people that were displaced by the floods? Where are they? Fine. By the time we have such kind of floods, so much effort has been undertaken in the background. When the forecast is issued, and we are able to identify the areas that are most likely to be affected, we are like in the March, April, May flood situation. We already had started making some efforts towards prepositioning of some foods and non-food items. Those efforts had already been made by the Kenya Red Cross, who were already doing the supplies in the different areas. So just as much as we had those floods, but then some efforts had been undertaken, and that's why we were not able to realize the many deaths and that we would have expected, given the magnitude of the floods that we had. Fine, where are they? Those ones that were displaced. Fine. As you are very much aware, we had a setup where in the National Operations Center, where we had a team, multi-sectoral team, looking at the medical needs of the people, any other needs of the people, the food and all that. These were constantly being monitored, their shelter needs and all that. Then this process continued up to the time when the floods were completely subsided, and these communities were able to resettle back to their their places. Okay. So, as far as we are concerned at the moment, there is nobody who is still in the evacuation camps.
Okay.
Thank you.
There was an issue of risks of relying on technology, and I think, Doctor, you can come in on that and talk to us about relying on technology. This was a question from Eugene.
Yeah, I think I would. There are also limits to technology. I think I totally agree with that, and it's not that this is also the only way solution. You don't have to develop a super complicated, what we say, impact-based forecasting model where you overlay different data to take action ahead of a disaster. I mean, you can also take a more soft approach. We have a certain decision-making body of people, of experts that monitors, observational data, for instance, and then takes action. So, just.
Okay. There's also an issue of risk assessment. How do you prioritize which risk and which one to act on?
Yes, so thank you very much. I think partly that was answered by Irene, but let me also answer the question a bit on my friend David, talking about what ICPAC is doing with regards to research. What I quoted, those were figures from as a result of research. And ICPAC is building research evidence base so that we can use that information as an advocacy point to tell the government, to continue working with the government that anticipatory action is possible, is working, and there's need for the government to mainstream that within the system. So we are working with universities and other credible research centers in the region.
Okay. Osman, I'd like to hear comments on the involvement of children and youth. Hannah asked that question. How best to do this? You had challenged us earlier on to involve more women. Now maybe you'll challenge us again to involve more youth.
The thing is, the approach that we have used and experienced within the Raja is to include all the slides from the community. So from the start of the research, at the research phase, when we collect the baseline data through household surveys, so there is a focus on youth, there is focus on children, and as I said earlier, we had an intervention was based on the children, the students in the primary schools, and because why we took this approach, because children are eager to learn and they love to ask questions, so they absorb the information and the explanation from those, during the capacity building that was done by the meteorological agency very fast, and they helped in simplifying that, and just transferring the news and the weather forecast to their parents at their home was very influential, and it created a big impact of the Raja. So the thing is to include everybody from the community into co-producing and co-designing this service definitely achieves the success of the intervention.
All right. Dr. David, there was a quick question from James on the extent a disaster has to be so that it's declared a national disaster. Very briefly, 1 minute.
Okay, we have different levels of disasters. We have a disaster that just affects the small locality, and then that is at the sub-county level, and then we can have a disaster which is just limited within the county setup, which can adequately be managed by the county, and then there is also another level 3 which affects a number of counties. And then that is when the National Disaster Operations Center comes in very, very strongly. And then there is a disaster where at the national level, we may be overwhelmed, and it requires the external intervention. Okay. Then that is where we have the declaration of a national disaster.
Okay. In just under a minute, let me take closing remarks, and I'll start with you, Dr. Ahmed Abdihun, in terms of what are the next steps from here?
I think tomorrow we are going to issue a declaration on the outcome of this East African Dialogue Platform, which is going to be a collection of key takeaways from all the discussions over the 3 days. What does that mean is I think IGAD is going to follow up on those key actions together with a number of partners that have been engaged on this arena of anticipatory action. I think that's going to be the main next steps in terms of as an outcome to this platform. Yeah.
Okay. Dr. Nicholas, what do you see as the next steps from here? What are your key takeaways? Let's preempt what Dr. Ahmed wants.
The key takeaways, I mean, here for the development in the region, I think it's great. It's really fantastic to see the current momentum. I think this has been really, anticipatory action has been really brought up on the agenda of government thanks to ICPAC. Another thing is really to translate this into practice. And that means basically to implement the roadmap, which means, set up or develop the technical working groups that have been set up in the governments to then develop a national strategy to bring anticipatory action to scale.
Okay. Dr. George?
So my takeaway is also maybe linked to that, and also from the discussion on the platform. I think we could have the feel that pressure and attention shifts to the government, even in terms of the questions. So my key takeaway from this forum is to begin an honest discussion, how the government plays a central role in terms of pushing for anticipatory action and mainstreaming it, and practically moving towards implementing the anticipatory action on the ground.
Okay. Osman?
My key takeaways from this is like we are at the starting point of making and integrating all these efforts together. So acknowledging that there is a need for anticipatory action. And let's be honest, we are in Africa, one of the most affected areas around the world by climatic events. And we are in an era of, with the phenomena of climate change. I'm not a climate scientist, but we are experiencing that. The events are getting more frequent, more intense, and we are suffering from that, although we are not contributing to the source of the issue of climate change. So in order to be, we have to be prepared for that, and we have to make sure to which generation are we going to give this land. So anticipatory action is the answer, and we don't have the resources. We are limited. We have a lot of challenges. So we have to shift from being reactive to proactive, and that means at all levels, from the community level, the government levels, the international organization levels. We have to acknowledge that, and we have to come to a common ground, all of us, in order to implement this on the ground and to move forward.
Okay.
So this is my takeaway, and I think tomorrow, with tomorrow's declaration, with all of the collaboration and networking that happened during the 3 days, I think we are going to witness a change in the practice of anticipatory action in East Africa and hopefully in the whole world. Yeah.
Okay. Dr. David, final?
Fine. My key takeaway is that as a country, we have a government-led anticipatory action roadmap, which we need to carry it to the next stage to operationalize it. I call upon all actors in this space so that we can work together to ensure that we are implementing this roadmap fully.
All right.
The second message that I can pass across is that next week, we shall be having International Day for Disaster Risk Reduction being celebrated here in Kilifi County. I call upon all the actors to be present so that we can share our experiences more and more in this field of DRM.
Right.
Thank you very much.
Thank you very much for making time this evening. Dr. David Nanyende, Technical Officer, National Disaster Operations Center in Kenya, Asante Sana. Ms. Ezra Osman, Project Officer, Resurgence Daraja East Africa Program. Thank you very much for making time. And Dr. Jojo Tieno, Thematic Lead Anticipatory Action at IGAD. And Dr. Nicholas Shearer, Lead Policy and Advocacy Anticipation Hub. Thank you very much for making time. And Dr. Ahmed Abdihun, Program Manager, Disaster Risk Management at IGAD. Thank you all. And thank you all for being a fantastic audience. A round of applause for yourselves. I know you had more questions to ask, but we've really run out of time. We appreciate all your time here, and this is where we leave it for now. Special thanks to the Pride in Paradise here for hosting us tonight. And Jeff, it's back to you, and thank you so much, live from 001 Mombasa County. I could have gone to the beach right now, but it's too late, Jeff.